The Dan Yorke State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
Well, good evening and welcome to My State of Mind here on MyRI TV and Fox Providence. Dr. James Fanale is our guest tonight. He's the president and CEO of Care New England. Clearly, the hospitals are on the front lines when it comes to COVID-19. And it's interesting to talk to the hospital executives now because it kind of feels like today is a whole lot better than yesterday. And yesterday is only a few months ago. Kind of a fascinating conversation coming up with Jim Fanale about the disease itself, what he's learned, what the hospital business looks like, and what the future of healthcare system in Rhode Island might be. So please, we'll be right back with that conversation. Stay with us. Back to My State of Mind. Again, this broadcast was recorded on Tuesday afternoon and it airs on Wednesday night. I am honored to have the president and CEO of Care New England, Dr. Jim Fanale. He's always been accessible to us, even when there have been other kinds of times of trouble, with some business issues that have constantly been in the cycle over the last few years. But of course, now that COVID-19 has hit us the way it's hit us, he's speaking to that. We'll get to the business of hospitals, of course, a little bit later on. But Doc, great to see you. Thank you very much for joining the TV show.
Thank you.
How are you? And how's the hospital?
We're good. I mean, we've been through a lot in the last several weeks, but I think our people are enduring and keep moving on.
The COVID experience has been, well, everyone's got their own prism, everyone's got their own take, everyone's got their own tragedy. Unfortunately, there's hardly anybody that doesn't know somebody that's succumbed to this virus. But the inside out view from the hospital community has got to be still a unique one. Take me through the travel, if you will. Can you go backwards? Does it feel like 10 years since March when we really started to think, oh, we got a problem here?
Gee, I remember when our clinical infection control person came to me in like January and said, I need a COVID web page on our web page. I said, well, what are you talking about? It's only in China. It quickly became obvious we needed to do that. But yeah, back in March when we started, I remember we started working on this in early March, and then it just enveloped everything. I mean, it was, none of us were trained in pandemic management or relief, and we quickly assembled a team. But, I think in healthcare, in my experience, we're pretty damn good at managing emergencies. I remember one hospital I worked at 10 years ago. Believe it or not, the whole air conditioning system went out for the whole hospital at a 100-degree day. Operating rooms, and you can't run an operating room without air conditioning. And it became an exercise in crisis management. I mean, we brought in an air conditioning machine on an 18-wheeler to run the hospital. What I'm saying is that we're used to these emergency kinds of things and what I've been trained to do, and you figure it out as you go. So it really was enveloping 7 days a week, trying to prepare for everything sequentially, not enough equipment. It was a very interesting time, I guess. But the interesting thing is you really see the zeal of the people that work with you and how they just endure and they keep working and they keep plugging. I remember the one Saturday morning when I got this first call, or Sunday, I said to my wife, see ya. Why? I drove down to Kent because I think I needed to show up. What can I do? Not a hell of a lot, but at least they see the guy there, right? But our people hung in there. We have specialty hospitals with special issues, women and infants, and NICU, and then in the Med-Surg Hospital, Kent, and Butler. They were all different, but people hung together and we got through it.
Well, it's interesting. And again, folks, just to remind you that Care New England has Kent Hospital, Butler, women and infants, and to Jim's point, they are all unique in the product and service that they deliver. It's funny, here we are in June. We're going to soon enter phase 3 in Rhode Island. We see stories of spiking all across the country, but we are doing a little bit of this kind of retro discussion. Boy, way back when, that's 3 months ago, way back when, it was crazy. You seem to be reflective, almost as if there's a past, at least, to this story. Do you feel that way?
Partly. I do think, I've watched this region. I've watched the state of Rhode Island, the state of Massachusetts. I've watched them be somewhat close in how tight they managed it. Seems like we're in pretty good shape, right? I think this mask thing is really important, I think, and social distancing is important. I think when you walk around the streets, you see people that are wearing masks. So I think the preventive nature has helped. Are we worried it's going to come back? Yeah, I'm worried it's going to come back. Are we working on making sure we have PPE and ready and have separate places for every? Yes. I think we've got enough ventilators if it should spike. We hope it doesn't get back to how bad it was. But we still have COVID-19 patients in the hospital. We've probably got 10, 15 people in the hospital now. We used to peak out at 40? At Kent. So we've been able to get through it. There might be a pass, but I think you don't want to wipe it out of your long-term memory, because I think it's going to be around for a while, and it may peak as things go. Now, in the other states, I don't think they've been stringent in this preventive control. I think this region has, and I think it's probably paid off. That's the only science that I can figure out.
What have you learned about this virus since it began?
I've learned that a couple things, right? So it's not a good thing for older folks, okay? It's a terrible thing for nursing home residents. If it decides to do its dirty work, it's a vicious combatant. If it's a mild flu-like syndrome, people get through it. But if it decides to hit you, it's an ugly disease. It's a very bad, rapidly progressive disease. And the folks who get it full thrust, they're lucky they get out of hospital 5 or 6 weeks. Otherwise, they're there for a couple of weeks. And if they succumb to the virus, it attacks all systems. So it's a nasty agent. Generally doesn't bother lots of people. When it does, it's terrible. The nursing homes have to be protected. We have to continually work to make sure that we're stringent there. And then older, sick folks are much more prone.
Talk about it as if it's got a mind of its own.
I'm telling you, if you've seen and read and heard about the vicious nature of this thing, when it's bad, right? When it's really bad, it's bad. We know that socially and economically, it affects Latino populations and African-American populations more. We see it in Pawtucket. Our tent up there to test people, we've got a 20% positivity rate. And in the rest of the country, it's far below 10%. There was a study in one of the, I think, New England Journal yesterday that talked about that, or in the Annals of Internal Medicine, talked about people are more, African Americans are more prone to it when they get in the hospital. So there's a higher prevalence of disease in African American folks. When they get in the hospital, the mortality rates are similar between the two populations. So it has to be about socioeconomic, socio-demographics, close living quarters, et cetera, that causes that high infection rate, at least our impoverished people.
All right, when we come back with Dr. Fanale, this president CEO of Care New England, we'll talk about the business of the hospitals and where we go from here, and what have we learned from this that we can apply not only to the virus but to other other diseases. So we'll be right back on Dan Yorke's State of Mind. Please stay with us. Back to My State of Mind, this Wednesday original program recorded yesterday afternoon. Dr. Fanale, the boss at Care New England, reflective in our first segment about this entire thing. The testing, Doc, it's still speculative, it seems, between the immediate test to see if you have it in status and antibody test. How confident are you about where the testing is in terms of its accuracy, and will it get better over time?
Yeah, so I think the answer to the second part of the question is easier. I think it will get better over time. If you remember, the availability of testing was markedly limited. And all of a sudden, you have all these testing modalities from different companies. And I think that in history of time, the FDA takes its time in approving those tests, right? And so because of the rapidity of the disease and anxiety it caused, I think testing facilities were approved much more adroitly than they would have been in past times. So there was a lot of discussion about these rapid tests. Are they as accurate? What's the false negative rate? Meaning, if it's positive, it's positive. If it's negative, take a guess, right? I think there were higher false negative rates in the newer, quicker machines, but I think it's gotten better. And the story about the antibody testing, its value is still not there yet. So I think the whole full story really isn't out yet. Okay, really, as this whole thing unfolds, we have at least 3 trials around the country, around the world on vaccines, and I really still think most people would say we need that. There's some initial discussion. Remember, there was an antiviral agent that decreased the course of the disease, like from 18 to 14 days, and then another study, dexamethasone, which is a steroid agent that's been around forever. It costs like 2 cents a pill. That's been shown to also hasten recovery of people in the ICU.
Do you have docs that are forgive the term, experimenting as we go, doing what they can, found something that they think is unique, reported it out to the CDC, that kind of situation?
I think that I wouldn't say experimenting, but I can tell you that most of I know Lifespan, Rhode Island Hospital, ourselves, we were part of this remdesivir trial. So we have access to remdesivir because of the clinical trial we're in. I know when I've talked to other intensive care units across the country, because of the rapid inflammatory nature of this virus, folks are using either high-dose steroids like the dexamethasone drug I just referred to, or high-dose anti-immune agents. So people believe there's some autoimmunity process to this disease, so people are using it. Is there a study that says high-dose steroids work? Is there a study that says these autoimmune drugs? No, but I think most centers are using combination of an antiviral agent, antibacterial agent, plus some anti-immune agent like steroids.
You've been actually, I think, really, I think you're a pretty pragmatic guy anyway, but you've been very clear about caution about, at least early on, about some of the hip things. Now, look, I had an experience in my own business agent was reportedly on death's door. He got the hydroxychloroquine and came out, and a doctor told him that, guess what? He was 20 for 20 with hydroxychloroquine in his Florida hospital. So he's thinking it's the game changer. And all of a sudden, the CDC starts to get a little wary on it, and then we get different reports. The entire time, you said, really, hold your horses on this whole thing. How do you feel about it now?
I still feel the same way. I mean, the only way you know if stuff works is if they study it. I mean, and, hydroxychloroquine become the fad, and, we're really happy that our president thinks he's taking it to prevent himself from getting old. That was a bit of facetious. But, we've learned that to prove things work, you have to prove it in science. So, what would happen if your friend that day got a high-dose Tylenol and got better? Uh-oh, it's the Tylenol. Well, it's not. So when a doctor in Florida says that 20 of his patients got better in hydroxychloroquine, I just have a hard time believing, because that's not what the data shows. And hydroxychloroquine is a good drug for people with malaria, people for rheumatoid arthritis. I have a family member that takes it. And the family member said to me, gee, if everybody else takes it, I won't have it for what I need it for. That was another finding piece, but ultimately it hasn't proven to work. People I know are probably still taking it, right? But I stand by that.
Tell me about our preparedness. You worked with the Romano administration. I think the governor did a very good job on slowing the curve early on. I've got a lot of qualms about a lot of the other phasing applications. But the one thing that's kind of damned if you do, damned if you don't, right? She spent $35 million in facilities just in case you guys couldn't handle the load at the hospitals, you and Lifespan. Looking back on it, do you think that was a wise decision? And B, God forbid, do you think we'll ever have to use those facilities?
So listen, I think when you start to look at the models coming out of this, it predicted we'd need like 3,000-4,000 more beds than we needed. Now, remember what was going on in New York City right then. New York City was devastated. Now, different living environment in the city. You got 9 million people living within a block of each other, but we're only 2 hours from there. So with what was going on in New York, what was beginning to develop in neighboring Massachusetts, I think being prepared with 2 field hospitals was probably the right thing to do. Now, initially it was 3, 4, 5, or 6, and as time went on, really only did 2 fully develop. So I don't think there's any other way but to do that. So Massachusetts, they did the same thing in sites across the state, probably 5 or 6 or 7 sites. But I think it was the right thing to do. I hope we never use them. I doubt we'll ever use them. But it did teach us to be prepared. We actually know we could do it again if we had to. But I think it was absolutely the right thing to do. I think the story to be told about all this is to see if all of us can make sure we have I hate to use the word, but I'll use it, stockpile of equipment, right? It's a personal protective equipment, it's gowns, it's N95 masks, it's regular masks, it's gloves, shields, and we didn't have enough of that. The supply chain was in China. China got hit. If we had had all that stuff early on, I bet you we would have even impacted the disease even more. But remember, we were learning a lot back then, right? So everybody's wearing masks to protect themselves from giving it to somebody. But the theory is if everybody wears them, nobody's going to give it to anybody. But, a lot of, you look down south in Florida, they just decided they don't need to. I mean, I hate wearing a mask. I don't know about you. I'm uncomfortable as hell. But if I go into anywhere public, I think I need to respect the other people there and wear it, right?
And I think we're pretty convinced at this point that that is going to be the thing that slows things down. Speaking of slowing down, the business of hospitals they're in trouble. We're going to need some federal stimulus in a big way. We'll talk to the doc about what he needs coming back. Stay with us on Dan Yorke State of Mind, please. For our final segment here on Dan Yorke State of Mind, Dr. Jim Fanale is the president and CEO of Care New England. Look, it must drive you nuts. Your executive work turned the corner on Care New England over the last couple of years, and it was a real good story. Whether you were going to marry Lifespan or they were going to marry you, and or the merger with Boston, the whole thing. All during that, you were able to get your hands all around this business. Then this thing hit and kaboom, right? How bad is the kaboom? I mean, how really? Where are you?
So the first 5 months of the year, we're at a loss position of 6 or 7 million. We budgeted to lose 3. I thought we'd make that up by the end of 20. I did. So in the next 3 months, March, April, and May, 50-something million dollars loss, 52 million. Total close to 60 when you add everything up. It's pretty hard to handle. I mean, remember, it came on.
You have a line. Where are you managing your cash?
Well, so a couple of things. One is that we got an advance payment from Medicare for future bills, right? One health plan helped us out a bit with an advance. The CARES Act allowed us not to pay payroll taxes. Okay, we have to pay all of this back. It's just loan, so it's cash, right? And so that helped us tide it through. That helped us. Now we're looking for the grant kind of thing. So CARES Act money came through with the 20-something million. There are various formulas for the distribution of that cash, which really rewards hospitals with Medicare and with Med-Surg beds. We have a behavioral health hospital, not a Medicare payment. We have a women and infants hospital, by definition, not a lot of Medicare. So we've been sort on the short end that no one's fault. Just the formulas don't work for us. The governor, in her first stimulus package, using part of her 1.25, has sent out a note on Friday about her support for the hospitals. That'll probably be public the next day or two. Incredible support. This helps. So when it gets public, you'll see. So together with the first tranche of the CARES Act money, with what the governor's folks came through with last Friday, which we hope we see this week, I'm happy to say I think we got through May. Okay? June, July, and August, remember, we don't like losing $5, $6, $8, $10 million a month, but I think June will probably be shy of 10, and we got to figure out how to make that up.
So in the middle of this, and we only have a couple minutes here, in the middle of this, you've had a very good synergy with Lifespan. You spent a lot of time sharing thoughts. You've been presenting together. There's a rekindle discussion, perhaps at the end of this, to do, like one more time. Now that we've been through this mutual trauma, maybe we can put this thing together.
Yeah, listen, there's no question that during this pandemic, Dr. Babineau got together frequently, every day, several times a day, to try to work through together. We actually helped each other out with equipment that we needed. That never happened before, right? And now we announced 2 or 3 weeks ago, we're going to try to sit and see if we can build an integrated academic health system for Rhode Island, for all of Rhode Islanders, that will build, importantly, a resilient healthcare system for the state. You've got Rhode Island Hospital, which is intrinsically important to the state, and you have our Women and Babies Hospital. Both of them serve everyone in the state, probably a higher Medicaid population. We got to figure out if we could come together and have an integrated academic health system, Can we serve the state better? A year ago, forget about it. I don't even know what happened a year ago. And I really mean that. We decided to start these discussions. The process has started, and we'll see where it goes. Our goal is to see at the end of 90 days, is there something here that we can really help the state of Rhode Island? And I think we're confident we might be able to do that.
I guess my last thought is, this COVID thing has brought a lot of disaster, a lot of despair, a lot of disengagement, a lot of anxiety, but it's brought some stuff that's kind of like, we can do that better now. Blah, 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 blah. So on that, is that side is what you're weighing on. I got 30 seconds.
Yes, that's helped. Telehealth has helped. I mean, healthcare is going to change rapidly. In the state of Rhode Island, if we can use telehealth and we can build a different model of care together, I think it's stronger for the state. So forget about all the regulatory stuff we have to go through. Is there a vision that we can actually do this? And that's what we're going to try to do. Right. I'm confident we can probably do it.
Right. Well, listen, it's great to have the update from you. I appreciate your accessibility and the good work, to the doctors and the nurses and to the management at Care New England. Thanks very much. And we'll keep tabs. Wear your mask. Don't touch your face. Right?
Well, take care. Thanks, Dan. Take care.
Thanks again to Dr. Fanale from Care New England. We'll continue to check in on our medical facilities over the course of this COVID-19 pandemic, but at least it feels better that things have tempered, and it's cool to know that he doesn't think we'll ever need those auxiliary hospitals. That at least ought to give you some kind of peace of mind. I hope you have a great evening. We'll talk to you on the radio tomorrow at 2 this week until 6 on WPRO. Thanks for watching. We'll be back here tomorrow night. Good night.